A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
The holidays can be a stressful time, and this year could be even more difficult with COVID-19 thrown into the mix. Many are coping with holiday loneliness, magnified by the pandemic, and some are mourning the loss of a loved one due to COVID-19. On today's episode of your Hometown Health Connection, I'll sit down with Elizabeth Woike-Ganga, President and CEO of Best Self Behavioral Health, and we'll share some tips for coping with all this extra anxiety. Here at the studio, we are taking some extra safety precaution. Through the magic of television, our screen may show that we are sitting close, but in reality, we are more than 6 feet apart. I hope you enjoy our show. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. As COVID-19 surges across the country, people have lost family members and others have loved ones now in the hospital. Many are completely alone. Schools have shifted back to remote learning, and local barbershops, salons, and gyms are ordered to shut down, adding to more economic stress. All this is happening with the holidays on the horizon. Here to talk about ways we can cope with all this additional stress this holiday season is Elizabeth Woike-Ganga, President and CEO of Best Self Behavioral Health. Elizabeth, welcome. Thank you so much for being with us here today.
Thanks so much for having me.
You know, the holiday season is a time of year where friends and family get together, but this year is exceptionally hard because COVID is keeping so many of us apart. Have you seen an increase of people looking for mental health services at Best Self?
Yeah, at Best Self, we're definitely seeing an increase in people who are being referred for our services, who are seeking out services, and certainly anyone who had any kind of prior anxiety or depression or substance use, for example. A lot of people are really seeing an increase in that at this time.
How concerned are you right now with all the escalation of people perhaps needing more help right now?
I think right now is a particularly concerning time. The holidays can be a difficult time for people just in general, and now with this, people were, I think, feeling a little bit better, like things were a little bit more under control, and now they're having memories of back in the spring and also experiencing that isolation from family members.
Now, you are available 24/7.
Yes.
Walk me through what that might look like if I gave you a call right now.
Sure. At Best Self, we have various ways that you can access us 24 hours a day. You can go to our website, www.bestselfwny.org, and we have a chat feature, and a live person is on the other end, and we'll chat with you and see what it is that you need and call you back and get you into services and a counseling session right there if you need it. We also have our central intake line that you can also call 24 hours a day to get information about our services or to be linked up.
Absolutely. That is just, perfect. Sometimes people might be afraid to just actually go in person, right? And maybe the first step is just perhaps talking with someone online through one of your virtual chats.
Absolutely. I think that the opportunity to just talk to a counselor, ask them maybe what is the counseling process like, what am I signing up for, and just being able to hear someone who's able to understand what you're going through on the other end of the line, I think can be a great first step to getting some help.
Right, and sometimes, you really want to reach out, but you're scared. You might be afraid, what if someone finds out? If someone reaches out, I'm sure your information is all kept confidential.
Everything is totally confidential at Best Self and in every other mental health treatment provider. It's part of what we do.
Talk to me about the locations that you have. You are all over Western New York, correct?
We are, yeah. Most of our locations are in Erie County, but we have locations in the North Towns, the South Towns, the city of Buffalo, rural areas. And most importantly, I think during the pandemic, we've really ramped up our virtual services. So it really doesn't matter where you are. You don't have to come into the office. You can get services right from your home or wherever is convenient for you.
It's fantastic. If you are experiencing a crisis right now, what is the best number to call if I need help right this moment?
So if it's an acute mental health crisis where someone is maybe in danger of harming themselves or someone else, you definitely want to call 911 or crisis services at 834-3131. But if it's not an acute crisis situation, then you can reach out to Best Self or another similar agency.
Now you offer a well-rounded type of treatment. What's some of the resources that I might also be connected to, and perhaps your partners?
Yeah, we at Best Self, we provide services for all ages. So young children, adolescents, teenagers who are having a particularly hard time, all the way through young adults, adults and our seniors. So we can really provide a range of services to people, from individual counseling to group therapy and medication if people need medication to help manage their what they're going through.
You know, unfortunately, we're starting to see a rise in numbers of people experiencing domestic violence, death by suicide, child abuse, opioid use. Do you think as we get closer to the holidays, we'll see this even more?
Yeah, I do think that the holidays, as I said earlier, are already a very stressful time for people. So we already do see an increase in normal years of substance abuse, for example, of stress, of suicide attempts or self-harming type behavior. We're certainly already seeing and anticipate continuing to see increases in domestic violence, difficulty identifying child abuse with the kids not being in school, and then some of those suicidal thoughts and behaviors. So it's really important now more than ever for people to be reaching out for help and know what resources are available.
So let's say you are someone perhaps watching right now, and you are a victim of domestic violence. What are some tips you can give that perhaps someone can reach out discreetly?
Yeah, there are a lot of different options for people. Definitely, we want to make sure that people are safe when they do call or chat in. Chat and virtual is another option for people to link up that maybe they didn't have in the past. But there are a lot of resources out there with counselors who can help people find the resources that they need and link up to services in the community, or just hear what their options are.
Okay, and just to repeat earlier, the virtual options, you have both the chat option on the website, and then you can also phone and have an actual FaceTime type call.
Correct. So people can go to our website and chat in. It says "Get Help Now," and then there's a live person who is monitoring that chat. Yeah. Or you can call the main central intake number, and that same team is there available to answer the phone also if people call.
That's fabulous. That's definitely a great opportunity to have for someone that might just need a few minutes, a few seconds to get away to reach out for help.
Yep, that's it.
So Buffalo has a large refugee New American population, and mental health can be tough for a lot of communities to speak about, but especially in these communities of color, these ethnic communities, there's definitely a stigma tied to mental health. Do you have a specially trained therapist that can reach out to these communities?
Yeah, Samantha, unfortunately, stigma is a big issue for all of our communities. So we definitely make sure that we have counselors who are trained to reach out to all of those communities, and we also try to employ people from the community to help bridge that gap, and interpreters, cultural brokers, if you will, to help reach out to the different communities that might be suffering, particularly our communities of color, who we know are extremely vulnerable to the virus, frontline workers, and lack of access to health care from time to time. So we definitely want to make sure that we're available to them, and we are. We have an interpreter line available, and also bilingual, bicultural counselors.
If you perhaps what words can you say to encourage those that perhaps come from an Asian, Latino, or Black American community, and they're struggling with those cultural barriers? Lots of times in those communities, they think about, oh, it's a mind weakness, but it's so much more than that. What words can you give them?
Well, I would say for everyone, mental health issues are a medical problem that is treatable, and it's nothing to be ashamed of. It happens in every community throughout the world, and if someone is suffering, there is help available, and mental health professionals are often very well trained in engaging anyone and explaining in a easily understandable way kind of what's going on and how we can help.
Absolutely. It is just like any other medical concern.
Absolutely.
You go to the doctor if your stomach is hurting or what have you, right? Same way you'll go to a mental health trained professional to help you guide with any mental health guidance you might need.
Right, and different individuals and different cultures, those symptoms can manifest in different ways. So it might be a very bad headache or a stomach ache where there's no physical cause, or difficulty sleeping, ruminating, thinking, worrying. Those things happen in every culture. So definitely, you can always just reach out for help and ask some questions. No commitment.
I personally, I'm happy that you mentioned that. I personally, sometimes I'm someone who's always on the go, and I think I'm fine, and then I'm like, oh, I have a stomach ache or I have a headache, and that is a signal to tell me that, hey, Samantha, take a moment, check yourself. Your body's trying to tell you something. Right. So listen to your body, right?
Definitely. I mean, stress has an extreme impact on the body. And I think you and I both know that we've been going through some extreme stress for several months now. It's really becoming quite prolonged. And, that really does have an impact both on the chemicals in your brain and also on your body. And we carry that in our body. So definitely need to be paying attention to those things, knowing that they can happen to anyone and that there's help available.
Now, the older population has been really impacted by this isolation, and sometimes technology can be a little tricky for them. What advice do you have for them and for their families?
Yeah, it is pretty tricky. Some of our seniors are a little bit more savvy than others when it comes to the social media or using Zoom or FaceTime. But definitely, if you have an opportunity to introduce that technology to a senior loved one, I think it can really help to stay in touch. And even if not, give them a call a regular time each day to make sure that they have somebody that they can talk to, and let them know what help and resources are available as well.
So when people go to, perhaps meet with a loved one, maybe an older, your mother, your father, your grandparents, and you're trying to be safe and you're doing it through perhaps a window or from a far distance, talk to me about how those little things can help.
Yes, I think that as much as we can possibly do to make sure that we're staying in contact with people. So whatever that contact is. So whether it's leaving something on the porch or saying hi through a window, or ideally some kind of FaceTime or face-to-face kind of interaction by technology. We just need to make sure that we're making that extra effort to make sure that everyone who might be isolated has those resources and knows how to use them.
Right, because as much as we might want to give our family members that big hug, right? Those little things, those leaving a memento or seeing them from a distance, those little things really make a difference.
Sure, or even dropping a note in the mail or a care package.
There's a lot of households right now that are packed. Parents are working now full-time from home. Kids are back to remote learning full-time. Parents are definitely having a hard time, as the children. What can parents do? What advice can you give them to help them bring back some structure and normality back at home?
Yeah, I think there's a couple different things that parents can do. First of all, you mentioned structure. So it's really important for the kids to continue to get up at the same time that they used to have their regular breakfast, to take their baths, and get dressed and just as if they were going to school, to have their snack time and their lunch time and their play time sort of structured in. Safety, structure, and predictability are really very important for children, and obviously the pandemic has upended all of that, so we need to try to recreate that in our homes.
Yeah, I personally have noticed now more than ever, the little things that, now that I'm working full-time from home and, being socially distant from family members, that little things that if in that structure in my day-to-day gets thrown off course, it definitely throws off my balance now than before. Yeah,
definitely. I think humans in general thrive on structure and stability and predictability. And the pandemic is something that is none of those things. And so it's extremely stressful for people, and that stress really does build up over time. So we really need to try to recreate that structure in our day, even if we are working from home. So make sure you get up, you do your exercise, you take your shower, you know, have your breakfast, put your work clothes on, maybe at least on top, if you're wearing yoga pants on the bottom or something, but you know, just try to make sure that you can recreate that structure. Take your lunch break, take your, you know, breaks that you would normally take during the day, and just try to keep that as much as possible.
What are some specific type things you might look for as a parent that if a child is displaying something that's not like them?
Yeah, I think that there are certainly normal reactions to what's going on. So your child may be, for example, disappointed that they can't, you know, get together with friends for a play date or for that sleepover. But anything out of the ordinary that's very unusual, for example, severe changes in appetite, not sleeping, maybe worrying constantly, or certainly any kind of self-harming behavior, cutting or talking about, you know, hurting themselves, those are causes for real concern. And so that's when you should reach out right away for help either from your primary care provider or from a mental health provider like Best Self.
So difficulty sleeping, perhaps not wanting to eat.
Right, or like some extreme anxiety reactions, maybe panic attacks, just not being able to tolerate sort of the normal activities that they do, maybe not being able to get through that school day without crying or having a panic attack. That would be a time when you would really want to reach out.
What about speaking to parents specifically with those children who have special needs?
Yes, very challenging. Definitely important to reach out to your school district and see what kind of resources they do have for the special needs kids, because for them, it's even more important to have that structure and stability to see if there's any kind of special resources that they can access. And then I think parents really also need to take care of themselves, because children really pick up from their parents on anxiety and, you know, depression, or maybe if the parents are drinking too much, the kids do notice that. So it's really important, you know, as they say on the airplane, for the parents to put on that oxygen mask before you put it on your children. So as parents, we really need to make sure that we're taking care of ourselves, that we're taking those walks and maybe doing those coping things that help us stay calm and collected, so that we can project that to our children.
Absolutely. So taking a moment for yourself before you go address what your child might need.
Absolutely, because if they see us worried or crying or upset or having a panic attack, you know, the kids will get scared, because that will impact their sense of safety, security, and predictability.
If you need help, Best Self is available 24/7. Call the number on the bottom of your screen. You can even chat with someone on their website at bestselfwny.org. These are difficult times for all of us, but there is light at the end of the tunnel. When we come back, we'll talk about what you can do at home to find balance. We'll also show you breathing exercises with some real tangible benefits.
It's inescapable, the pressure, the sadness. But even in these uncertain times, there's always light on the other side. Best Self's behavioral health services improve the lives of Western New Yorkers every day and allow for 24/7 access to virtual and in-person care. Begin your journey and ensure your life gets the best you.
Welcome back to your Hometown Health Connection. I'm Samantha Latshaw. With me is Elizabeth Woike-Ganga, President and CEO of Best Self Behavioral Health. We're talking about mental health and managing stress through the pandemic. So if you catch yourself in a moment of high anxiety, what are some tips that you can give for grounding yourself?
Yeah, well, I think the first and probably easiest one that you can do anywhere is really just a deep breathing kind of exercise. Okay. So let's do one, Samantha. So you want to sit sit really comfortably in your chair with both feet on the ground. And if if the chair has arms, make sure that your hands are on those arms. And then, pay attention to how your body feels and try to sort of, relax into your chair.
Do you close your eyes?
You can. Some
Okay.
people like to close their eyes, some
Okay.
don't.
Okay.
And you know, we want to breathe into our bellies. So not with our chest lifting, but into our bellies. So
Okay.
we'll breathe in, 3, 2, 1, and then we'll hold it and then breathe out. So let's try again. 1, 2,
I jumped the
3.
gun
Yeah,
on
it's
there.
okay. Right. Okay. Breathe in. And then at the end, just, you know, pause before you take another deep breath. And it really can just, breathing just brings the body down into, you know, a relaxing kind of state. And really paying attention to it consciously, it's something you can do anywhere. In the car, at home, anytime.
And the goal is to hold it for about 3 seconds?
Yeah, in for 3, hold for 3. And
How
then
many
at
times
the
should you
end,
do
hold
that? Because
for
that
3.
really feels remarkable.
Yeah, I mean, if they're 4 or 5 times, as many times as needed, and sometimes you might only have time for 1 or 2, and that's enough.
What a simple thing to do
Yeah.
that can really just make such a huge impact. You could, like you said, you could do it in the car, you can do it in the grocery store in the middle of, if you're stressing out in that long pandemic line,
Right.
panic buying at the grocery store.
Absolutely. I think anxiety sort of takes us outside of our body and makes us feel like we don't have control. So a lot of times, you know, just feeling your body in that
Yeah.
moment. So even, you know, feeling your toes in your shoes, feeling your hands, you know, on the arm of your chair, kind of feeling your back up against that chair, just sort of coming back into your body, feeling that consciously, and then doing a few deep breaths can really, really, really help. And easy to teach kids also. And they can really respond to that if they're starting to really get upset about, you know, an online interaction or, you know, something that's not going well at school. You can teach them to do that too.
What are the actual health medical benefits to deep breathing?
Yeah, well, it really does, research shows that it has an actual impact on, you know, the chemistry in your brain, that you can really, you know, calm your whole body down by doing that.
Some people might say, you know, I really need to be with my family right now, and it's worth the health risk for them. What do you say to them?
Well, I would say that this is a very difficult time for everyone. And at the same time, we really need to protect people who are vulnerable from getting this illness, because much worse would be to have someone get sick. So there are many ways that we can be in contact and in connection with people that are not ideal, but that can help and help us feel connected. So we really need to try to think outside the box, come up with some new ways, and really, you know, understand that we're doing that for the other person's health in the long run.
Right, because we could have this brief moment of joy, right? And then have, perhaps if something goes wrong, a lifetime of pain.
Yeah, absolutely. I mean, you mentioned those empty chairs, and that's really, we want to have as few more empty chairs as humanly possible during the rest of the pandemic. So people really do need to be thinking about others and about their community, and, you know, spending some time really thinking through those values and what's important to you in terms of taking care of your community.
So what if you are the other side of things, and you want to stay home and have a virtual type of meeting for the holidays? However, your family doesn't want to hear it. What words do you give? Perhaps the person might be struggling to articulate this to a family member that doesn't want to hear it. What words would you give them?
I think that holidays for certain families and certain people can be a very stressful time. Maybe there's people you don't get along with quite so well in your family, and you might be arguing about other things at this time of year too, including politics or whatever else it is. So, you know, I think it's important to sort of set those limits. You know, I respect your view, but this is my view, and, you know, this year I'm going to set some limits, and, you know, it's okay if you don't agree with me, but not really take on that person's view of it as necessarily something that you have to go along with, and really trying to, you know, take this opportunity this year to clearly articulate, you know, what you're doing and why, and then just leave it at that.
So clear, defined boundaries.
Yes.
And of course, in 2021, will be better.
Absolutely. I think there's hope. It's important for everyone to focus on hope also, and kind of thinking about the vaccine and what'll be happening in the future for everyone, and focus on that future, but also what we can enjoy in the moment and how we can sort of reframe what's going on and try to find some meaning and some joy and some connection in our current situation.
Elizabeth, do I need health insurance to come see you?
No, at Best Self, we have a sliding fee scale for people who might not have health insurance. If you don't have health insurance and you're eligible for health insurance, we'll help you link up to health insurance. Also, obviously, a lot of people have lost their jobs or been economically impacted by the pandemic, but that is not any barrier. Also, there are some special waivers that are in place, so there's no co-pays or deductibles on most commercial insurance plans as well for the virtual visits. So you don't need to even worry about that during the pandemic, and everyone can just get the help that they need.
Wow, that's fantastic. So if you need help, money is not an issue.
It's definitely not an issue. We'll work with you, help you get whatever you're qualified for, and definitely won't keep that, let that get in the way.
In mental health, this affects everyone. It has no color, it has every economic, social background can experience mental health
Absolutely,
issues.
Yeah, and we see it all across our community, from Clarence to the west side of Buffalo. That's why we have locations throughout the city and the suburbs, because mental health knows no boundaries in terms of socioeconomic status, in terms of education, in terms of color, race. Like you said, we see it throughout our community, and we're there to help everywhere.
Right, like you mentioned earlier, it is just like any other type of health condition. If cancer has no type of specific group that it can affect, mental health can affect anyone. We're all in this together.
Absolutely, and you see that even just when you turn on the TV and see the celebrities who are also zooming in from home. This has impacted all of our lives and all of our activities, and certainly we've seen manifestations of mental health issues throughout our community, from actors to politicians to anyone. So we need to understand that mental health can touch all of us, and has more and more over these years, and especially in the pandemic, and that help is available.
Being sick over a holiday season is never fun. Being alone and feeling mentally distressed isn't either. Coping skills can help you get through the pandemic and beyond. We are all going through a hard time, so don't be embarrassed about needing a little help, especially if you find yourself struggling. So if it gets overwhelming, just remember, breathe in, breathe out. I'm Samantha Latshaw. On behalf of Buffalo Healthy Living magazine, thanks for watching. Stay safe and be well.
See more of this interview from Your Hometown Health Connection on the WBBZ-TV YouTube channel. A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living magazine and its sponsors.